That's a good question. What is a normal amount of sleep? A good question, because we grapple with that a lot in our society. Generally, though, it's believed about 8 hours, most people, but between 7 and 9 hours is considered normal. But you also need to look at someone's age. Someone who's 6 months old is going to need about 16 hours of sleep a day, so that the infant is going to be sleeping quite a bit. Someone who might be 16 or 26 years old might sleep a little less, of course. They're going to be sleeping about 8 or 9 hours a day. Sometimes adolescents can even sleep more, up to 10. And someone who is over 50 can sleep maybe 5-6 hours a day, and we often know people who get quite old and they might even reduce their sleep even more. Insomnia is really, it's a state of being. It really refers to problem sleeping, so that we know it best by having trouble falling asleep. But it can also be trouble staying asleep, and something called early morning awakening, where you wake up far earlier than your intended wake-up time and you can't go back to sleep. It can be a symptom across several disorders, so we can't really say that insomnia is always just in and of itself a problem unless you've ruled out everything else. Well, the causes of insomnia can vary. It can be anything from a simple life circumstances causing us some stress at the moment. It could be eating too much spicy food, or drinking caffeine, or drinking alcohol right before bed. Those can cause insomnia. Also, we could have other causes such as depression, anxiety, and other mental health disorders, bipolar disorder and mania. They can all cause sleep disorders. So getting a proper diagnosis and finding out the origin of the insomnia is one of the most important things that you could do. A lack of quality sleep can affect all areas of your life, and of course people who don't sleep know this quite well. They might have problems in their relationships, they typically have problems in their work or school performance, and it can also make every other problem much worse. If they're already feeling a little irritated, if they don't sleep, that can come out as full-blown anger. Or if they're already feeling very sad, they might feel even more sad during the day. So not sleeping can actually affect every other area of your life. Short-term treatments typically are medications, especially prescription medication. Approximately 3 to 6% of the general population is taking a prescription sleep medication at any one time. And also a lot of people, maybe a much larger number, take over-the-counter medications and herbal remedies. Medications have several problems about continuing to take medications presents several problems. One is that several of the sleep medications are addictive, and a lot of them start out saying they're not addictive, and then we later find out that they are addictive. So it's a little tough to know sometimes. The other is that when someone gets onto a sleep medication, when they stop the sleep medication, they often have something called a rebound insomnia. So they've stopped the medication, then all of a sudden their sleeping problems come back with a vengeance, and sometimes much worse. One of the very best things you can do to treat your insomnia is to develop better sleep habits. This is also called sleep hygiene. And this can be broken into several areas. One is how you arrange your room. Do you block out all light? Do you block out all sound? Do you have a bed that's comfortable to sleep in? Do you have a partner that's comfortable to sleep with? Or some people have partners that snore a lot, and that can be part of the problem. Do you use your bed just for sleeping and sex? So you associate your bed with sleeping and sex, and you don't associate your bed with stress things like watching TV or doing homework. So keep your bed separate for those things. Another thing you can do is to reduce food intake closer to bed, because of course if you have a full stomach, you're going to be digesting. So you want to eat only very light things, like maybe a piece of toast or something small right before going to bed if you are hungry, or restrict it altogether. Not having caffeine 4 to 6 hours before sleeping. Not having alcohol 4 to 6 hours before sleeping, which I know is tough for a lot of people, but a good idea. And also, of course, not having spicy foods. And also looking at other things like reducing stress in your life, and looking at exercise, maybe keeping exercise to the morning and not to the evening, which is tough for a lot of people to do, because exercise stimulates the body and wakes us up. If you're still having problems sleeping, I would seek a therapist, especially a therapist that does cognitive behavioral therapy, because they can give you specific techniques to help you, especially dealing with the thoughts. Some people have thoughts and worries when they go to sleep. I won't be able to fall asleep. I won't be able to fall asleep. And then they worry about all the events in the day, and a therapist can help them deal with those repeating thoughts and give them a place to put them so that they can go to sleep. Another good thing, last is, our mothers, our grandmas maybe, always knew what was right, and counting sheep, believe it or not, is not a bad thing to do. Nor is saying your prayers before going to bed, or any kind of ritual at the end of the evening. Do the same thing every night. The last half hour, just be a creature of habit. Do the same thing every night, and your body will start associating that with going to bed. To find more information, there's a good website at the National Sleep Foundation, but it's just www.sleepfoundation.org. That's www.sleepfoundation.org. And if you want to find more information out about me, you can do so at www.drgreg.com.